So, hi everyone. Today is International Yoga Day, and so many of you must have, finished exercising by now. Must have posted your yoga day pictures and your yoga day videos here and there, and now probably you all must have gotten tired, and maybe you all are resting and watching Instagram. So I have my Yoga Day special episode of today with Dr. Ali Irani, who is from Mumbai, and also most importantly, he's been a wonderful mentor for me. And when I started my career, it all began under the blessings of Dr. Ali Irani. So I would also like to mention that. As a lot of you know that I'm author of this book, and the foreword of my book has been written by Sir Dr. Ali, and so that's how he definitely holds a very special place in my life. So if you guys can see the foreword of my page has his name there, and now today I have the privilege of having him as my guest, especially for this Yoga Day episode where we're going to talk about exercising during adolescence. Because I strongly believe that for an adult to have an active lifestyle, it's important that we go back in time. It's important that during the childhood phase, the adolescent phase, we encourage children to follow a healthy active lifestyle so that in future they understand the importance, and it should also come into an autopilot mode for them. So having a good lifestyle right from the beginning, exercising right from the beginning, is always something which is good for the overall lifestyle of an individual, especially in these times where most of us are always going through stress, no time to exercise, no time to eat right. And now this pandemic has given an eye opening to a lot of people. So for parents who are watching us, it's for you to realize how you can make your children understand the importance of exercising and how you can help them to develop that habit. So I would love to invite my today's guest, Professor Dr. Ali Rani, and we will add him to the chat now. So I'm going to add Dr. Ali to the chat. Kapil is writing, Mahi minnu churiya ya na ki tere bina dil nahi lagda. Thank God you're coming live. Wow. Kapil, so I see that you have been waiting for my live chats. Very nice, interesting. And we have lots of more people joining in. And now I'm going to add Dr. Ali. So Dr. Ali Rani from Mumbai will be joining in.
Good evening.
Hi, sir.
Hi.
How are you, sir?
Great. Good evening, everybody. Mahima, this is my first live Insta.
Oh, wow. Awesome, and
I've
that's
been,
great. Lovely.
many have been telling me, but never got, but could not refuse you.
Oh, so sweet of you,
And
sir.
the topic was good.
So sweet.
Thank you. I was listening to your kind words. And I should say your decision was so true, so nice. And I really enjoy seeing you on Insta, Facebook, when I read about your workshops, people coming to you, and you have grown so much in healthcare, especially women healthcare. And the book that I read about giving birth to a child was needed. And I'm sure all the youngsters listening to you would like to read your book and listen, and hoping that you will also become a mother soon. Looking forward for that.
Thank you so much, sir. Thanks a
That will
lot.
be your second book.
Yes,
That will
sir.
be your
Yes,
second book, experiencing the whole process.
yes,
I'm
sir.
with you.
So, sir, let's start with something about yourself. Please tell the audience about your background from being with the Indian cricket team to Shah Rukh Khan to Nanavati today. You have so much to tell the audience. So let's start with you now, sir.
I can't say from where to start, but if I have to say, um, yes, I've been from a very ordinary family. My father used to own a restaurant in Nanavati Hospital. So after schooling and doing our homework, my mom used to send us to help dad. So as we grew, he was more relaxed, so we could manage the thing. So did our schooling through working and schooling. But maybe because I was in a hospital atmosphere, that vision was there to work in that hospital. And I remember I was in 12th standard playing football for my college and got injured. And when I was to a physio, I was told that India does not have a sports physio. So
Okay.
maybe there was a first ring. So asked for his guidance. He said, okay, you need to do physiotherapy and then go for specialization in sports. Straight went ahead and decided. I remember I was first in Delhi for physiotherapy.
Okay.
There were only 7 physiotherapy colleges in India. Only 7.
Wow.
Mumbai, Nagpur, Delhi, Chennai, Vellore, Calcutta. So, Baroda. Why I selected Baroda after 2.5 months I must have been in Delhi. There was an ad about the interview for the physiotherapy college in Baroda. So went and gave a entrance exam, interview, got selected. So preferred there because that was the only bachelor's degree in India. Rest all were giving diploma.
Right. Yeah.
I joined MS University, Baroda, then finished my studies, came back, joined Bombay Hospital, a lot of research work. Went ahead to do my PhD in anatomy of body movement and dance, and
Wow.
did my second PhD in sports medicine,
Wow.
and did my DPT in brain mapping. So
Wow.
now, and just before we are late, happy Father's Day to everybody,
Yes.
and happy International Yoga Day.
Yes.
So both of things have come together,
Together. Yeah.
and naturally people would want to learn. So as far as a baby coming to the world is concerned, Mahima is in charge. And once the child grows up, what to do, I would want to answer a lot of questions what the parents always have on the mind. So I will go according to whatever Mahima puts to me. My biggest happiness was when I finished my research. I was in Bombay Hospital when Nanavati offered me to come. So I was coming back to the hospital where I had worked in that restaurant.
Wow.
So most of the doctors were known to me. Most of the doctors had seen me going to school or working or washing dishes or making chai for them. So till today, in that canteen, even after 40 years, 2 of the servants are still there. And I
Wow.
make it a point. One just died 4 months back. And I still make it a point to have dinner with them or lunch with them once a month. So once a month, we have a separate lunch or dinner in the same canteen. So to have our old days memories to come back.
So beautiful.
Yes, I started a new trend in physiotherapy, no doubt. We were never attached to sports medicine. So when the offer came, I remember there were more than 272 applications for World Cup 87.
Wow.
Everybody had applied. Reliance World Cup it was. So from that application, 25 were called for the first round of interview and I was part of it. And then second round was for 4 and I was part of it.
Wow.
From 4, 2 were separated and again I was part of it. So it was Dr. Anand Joshi and me.
Wow.
Anand Joshi, the arthroscopist from Mumbai. Very, very, he has done almost all the sports people and Bollywood. He does the arthroscopy, shoulder and knee both. Then we both were supposed to go for that 87 World Cup, but it happened that the World Cup law rules didn't allow. Only one could go. So we had another round of interview, and I was called first. So I said he has come back from US, so he has more knowledge as far as sports is concerned. I'm a local boy. To my surprise, when he went in, he told the interviewer that he's a surgeon and he won't be able to do anything on the ground. But this lad can do anything on the ground.
Right.
That's how it zeroed down on me.
Wow.
So I feel grateful to him. We are good friends still. That's how my journey of cricket started. Nobody knew what is warming up, what is stretching. So you have to start from the base, tell them you have to, body has to warm up. Even when you sit in the car, you raise the car so the car gets warmed up. And whether you're riding a two-wheeler also. So the best thing is to warm up. Then the warming up starts, stretching. Why stretching? Your performance will be better. And then how I've worked more on prevention. I used to say prevention is better than cure. By that time, I knew what injuries they could get. How to prevent that injuries became more important. Strengthening of certain shoulder muscles, so when they hit a six, is crosses the boundary line. They are not caught at the boundary line. That importance was felt to them. Then running faster between the wicket. I remember we had started that fitness test. You know how many runs you can take in 1 minute between the wickets. So that was one of the parameter of the fitness. So whenever we wanted to test cricketers' fitness, we used to ask them to run between the wickets, and I used to grade them with that. Yes, it was a lovely almost 11 years with them, almost being to most of the countries in the world. And that time I used to run a department with almost 15 staff. So it was an extreme 2.5 months, 3 months, 4 months out of the country with 15 boys, and suddenly come back to Nanavati and you're with 15 girls. So the extreme we were, and that went on for almost 10, 11 years. I enjoyed. I enjoyed till Nanavati Hospital in 97 asked me to decide between the sports team or the department.
Oh.
So I thought I would not be able to last long with the team, but department was more important. So I came back and decided to be with Nanavati Hospital and started with 6, 7 patients a day. And thank God today we see almost 300 patients indoor and outdoor. We are 24/7. We have 2 or 3 staff doing night duties. We do Sunday duties. And of course, you had your spell of time being with us at Nanavati. It was lovely.
I'm
And
really shy, sir.
but you'll be surprised. We have more than we were counting. We were more. I have more than 800 physiotherapists in USA.
Oh,
Yeah, and
just in
now
wow.
they have formed a group now.
Okay.
So it's unbelievable. Like last week, they had called me online, some Zoom call, and I was seeing them. Wow, it was, memories. Each one I could remember something about them, whether they have troubled me or I have troubled them. But it was, and all are with kids. All are with grown-up kids. So I'm
Right.
talking about the 87 batch. So almost 30
Wow.
years back, all have married, all have kids there.
Correct.
And so nice. Some of them have their own groups there. I
Right.
must be having more than 100 in UK, almost 30, 40 in Australia, New Zealand.
Wow. All over
And
the
of
world.
course, I'm so happy that all over Mumbai, whichever hospital I go, either they were my intern, either they were a student, either they were doing the post-graduation with me, or they were my staff. So it's
Right.
a lovely feeling, lovely feeling. So when I come to Delhi, maybe I'll see you. I'll be so happy to see you then.
Yes, our meeting is still pending. It's been quite a long
Yes,
time.
yes,
Yes.
I agree. But anyhow, last 3, 4 months we have been dealing with Corona. And I only want to say one word about it. Uh, we should immune our body. Let us think. I always give an example. If a window, you are scared somebody will enter your window, what you would do? You will just grill your window, so you can sleep peacefully. So I say immune your body. Why you bother? It's going to be something like cold, cough, and then the viral diseases that we were getting earlier. So I make it a point to have 2 oranges in the morning, right? Or any time of the day. I make it a point for vitamin D. Drumsticks are supposed to be very good for vitamin D. Or those who are non-veg, the paya soup is yummy and one of the best source of vitamin D. Ginger tea, haldi doodh, old grandmother's recipe, haldi doodh at night. just immune your body. Good breathing exercises, which I've been seeing you showing it to your patients, right? A good vital capacity. And your Indians have less. A lung can take 4.5 liters of air, sometimes up to 5 liters. But most of the Indians have below 2 liters. So measuring them with spirometer, I think so. I could demonstrate it. So good vital capacity, lying prone, it's become very important. First people used to lie on prone. Your mothers used to shout at them, no, 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 lie down straight, lie on your side. You can't lie down prone. But today that's one of the treatment for corona patients. The job of a physiotherapist is to go and make them lie down prone. Deep breathing, increasing the vital capacity. So things have come so much. I remember when I used to be a student of physiotherapy, we were only known as a physiotherapist. There was no specialization. Then time came when people did post-graduation. Somebody wanted orthopedics, somebody wanted musculoskeletal, somebody wanted sports, somebody wanted neurology. Again, neurology got subdivided into pediatric neurology and adult neurology. Then people went towards chest PT, exercise physiology. It went on and on. We are specializing and super specializing in our field. And today we have more than 60,000 physiotherapists in the country.
Wow, lovely, sir, lovely. And
So,
also tell us something about your story with Shah Rukh Khan. I still remember when he came to the department and you had made me meet him.
um, I think so. When he was doing his Fauj shooting in Fauji, he had finished Fauji or still was doing Fauji. He got injured, and first time I saw him was that time he was brought to Nanavati to a department for treatment. We treated him, and then the stars keep getting injured. So every time, till even last time when he got his shoulder injured and knee injured, I was called. I remember he was shooting in Bhuj for some movie. He got injured, so I had to fly down and see him there. So anyhow, it's how you deal with most of the stars. Yes, they have to be treated as VIP. They have to be treated. They're different. They're different. You have to answer many of the questions. You have to answer many questions of the producers or the directors, whether you will be able to do, how much you can do. But they're a lovely bunch of. It's an experience to be with them, see them, treat them, and again tell them about their prevention, because they're very similar to the sports people. So even when I was out with the cricket, naturally they were watching cricket, so they used to see me there. So whenever they got injured, they used to think of seeing me or taking an opinion at least what's going wrong.
Lovely. So
Yes.
now let's talk about exercising during pregnancy, after delivery, and how I think the best time for an individual to have a recheck on their lifestyle, especially the pregnancy phase, because the baby is growing inside them. So, how important do you think is for pregnant women to exercise?
See, what I want you to add, because I think so that is your domain as far as getting pregnant till delivery. Nobody would be better than you to talk on it. What you should add to them is my overall experience that I am seeing to see that the mothers have a good vital capacity. So when you take a deep breath and that's the spirometer.
Right, sir.
So see, this is 2.5 liters. So when I'm going to just inspire, take my breath in, see, I can do 2.5 liters. You try it, they won't be able to. So best thing is try explaining them to do an exercise, which I just the simple way that I tell my student to do it or my patients to do it. Take a deep breath through your nose, right? And when you're coming out, come with a hissing sound.
Hissing sound, okay. Nice capacity, sir. Very nice.
You come out fully, right?
Very
Still,
nice.
I'm not touched 4.5 liters, but I'm somewhere near 4 liters. So if you practice that, so make it a point. Why? Very important. Why? We should know why do we breathe. Whole idea, process of breathing is what God could have made it such a way that there was no need of breathing. Our blood circulates all over the body, comes to the base of it, it carries all the nutrition, comes to the base of the lung, right? So when we breathe, whatever shallow, our breathing are usually shallow. Whatever we breathe, the air goes in and it only contains less than 20% oxygen. The best air going to a hill station would contain 21% of oxygen. Otherwise, cities are just 17, 18% oxygen. So the oxygen hits the impure blood which has come. Just the oxygen hitting, the oxygen being taken, the blood becomes pure, goes to the heart, and heart pumps it all over the body. So it's very important to make your blood purer, right? By giving the oxygen. So blood will get more oxygen if your vital capacity is more. So Ramdev Baba preaches the breathing exercises or pranayam, what we do. That increases the vital capacity. And marathon runners have a good vital capacity. Sports people have a good vital capacity. That's how we are not finding corona in them,
Right.
any sportsmen, right?
Right.
All those have a good vital capacity. Good, those who are, practicing yoga, breathing yoga, they don't. Because it attacks corona for the first 3, 4 days, it's at your throat level. So kill it there. Regularly hot water, right? Or I keep having my black tea every hour. So it kills it there. Two, if it don't want it to enter the lung, have a good vital capacity. So my request will be tell all the mothers to be mothers also to have a good vital capacity. Prepare, right? Two, most of the Indians have deficiency of vitamin B12 and D3. Now, B12 is in charge of all your muscles and nerves. D3 is in charge of the bones. Again, half of the Indian population have it less. So I do say give drumsticks, senga, the drumsticks in sambar, dal, or have a soup of drumstick at least twice a day, twice a week, thrice a week, nothing like it. Vitamin D3, right? So we need now for corona again, vitamin C is important. So 2 oranges or 2 mosambi or 2 lemons or guavas also have pineapple also have vitamin C. So you can have that. So keep your body immune. So all those are going to be gradually becoming mothers. Check the they should have a good vital capacity. They should have good vitamin D3 level, B2 level, vitamin C level. Nowadays, magnesium plays a very, very important role. Magnesium. Most of the musculoskeletal problem is lack of. So usually my blood tests for my patients now are vitamin B12, D3, magnesium. They should come with it. So most of the musculoskeletal problem may just go away because of the being deficient. I remember we had a back patient for long and we were treating, and then finally when we said, okay, do your B12, D3 level, both were so low. And just by taking the course of injection, nothing brings it faster than architol for D3 and methyl cobalt injection for B12. One of my student is doing her PhD. You must have seen her. She's doing PhD in footballers. So she has evaluated 8 footballers, 8 team, not 8 footballers, 8 teams. So 8 into 25, 20 to 25 players each team has. And they practice 4 to 5 hours every day in sun. It was shocking. The reports, all of them were having deficiency of vitamin D3 and B12. So we had done few tests. We had asked them to kick the ball at what level, how much distance the ball travels, and at what timing it travels, how much seconds it takes to travel. Suppose whatever it has traveled, 70 meters, 60 meters, then hopping, long jump, horizontal jump. We had asked them to do all that test and check their vital capacity through spirometer. When we saw the blood report, we gave them injection after 72 hours. We asked them to perform all that again. The vital capacity had increased by half a liter. 400 ml, 500 ml was the increase of vital capacity. So vital capacity has a role to do with vitamin D3. Sun does not give you vitamin D because they
Correct.
play 4 to 5 hours in sun. So then
Correct.
we found out a little more studies to find out to bind all this, we require magnesium. So if we have good magnesium level, then only the body absorbs the D3 and B12. So you should add in your guidance to be mothers before even they get pregnant, good vitamin D3, with B12, good vital capacity will make their journey more easier, better, healthier.
Right.
So coming to that, so it's your domain till they are out. Once they become a child, I feel every parent asks me what game the child should play, how much the child should play, when they should start. I have a very simple formula. Till the age of 12, till the age of 12, see that they play and know all the games. Let them
Okay.
enjoy every game. Let them enjoy. Because all the sportsmen I have seen, they have selected their game between the age of 12 and 14. When they're just going into that era of uh, puberty for the females or even males, the boys, when they are going to adolescence, that they are becoming, is when they have selected. So till the age of 12, but very important here, our studies show that the child may be in an IB school, in a private school, in best of school, the hemoglobin of the child is very important. So we have found out that sometimes child going to a convent school, a child going to a very ordinary school, the hemoglobins are better. So it's not necessary just because it's in a big school. So I feel the minimum hemoglobin should be 10 till the age of 10. So if you give a good hemoglobin level to the child, so again for you to tell the mother whenever they are checking the hemoglobin, we have found out again overall in general in Indians the hemoglobins are low. So maybe they come because the child eats a lot of junk food. They enjoy after they have that liberty to go around and they have money to buy. They will not be buying good food. They'll be having junk food. So to have a good hemoglobin becomes important in the growing stage. Allow them. I remember in our school, there were all games. Sometimes you were playing football, you were playing hockey, you were playing volleyball, everything. You were running sports day to get some medal, you were running. So you're doing everything. But as time passes, that's the time between 12 and 14 that a child decides, I want to only become a cricketer, only a footballer, only a hockey player, like that. Yes, the school plays an important role. There are certain schools in Bombay, they have nothing other than cricket. So any child being there, they would turn out to be a cricketer only if they enter sports. So their sports is going to be only cricket. Similarly, football. I know 4 or 5 schools in Bombay, only football. So top footballers come out from there. Then we have Otters Club and Kharjimkhana swimmers. They have lovely swimming pool, good coaches. So anybody going there turns out to be a great swimmer for the country. So once they have selected between 12 and 14, okay, we have selected this game. The role of the parents become now to find out a coach for them.
Okay.
Right. So a good coaching. Then hand over them to a good coach. So as the coach starts telling them, they found out in talent, whether if it is cricket, whether they're going to be a good bowler, a good batsman, a good wicket keeper. If they are into football, whether they're going to be good goalkeeper, back or defense or strikers. So then the specialty in that sports is selected by the coach. You train them for that. So around between 14 and 18, you could say they start becoming a champion.
Correct.
Now, after champion, they are professionals. Now, to remain professional, they require good weight training, regular training. They have to always remain in the peak fitness. To remain in peak fitness, you have to be really. So, I think that to remain successful, you have to keep winning. You have to be fit and keep performing in the sports that you are selected. And that's how you can last till the age of 45, 50 also. You can be playing for the country, depending on the sports. So very simple. The parents ask, allow them to play any game. You don't decide for them. Don't push them into particular game. I have seen cricketers' sons, they used to play football. They turn out to be parents. Father pushed them after that. No, football is not your sports. Go in cricket. So the person has failed there also, here also.
Yeah. Lovely. I
There are
think
there are other.
people enjoy cricket more in India because they watch it so much that they kind of follow
Yeah.
it more.
No, but I'm seeing no. I think so. India is going towards football now. I see it patient-wise. If I was seeing 15 cricketers in a day, right? So now it's other way around. I see 15 footballers in a day, and cricket has become five. First, five was football, 15 was cricketers. It's exactly the other way around. Especially girls. Girls play football more than boys now in India.
Yeah. Yeah.
Yeah.
So luckily now
Maybe
in
the
India,
love of
we
the game.
have girls going into sports. Yes.
And the why 2020 was coming in, because I feel people were too bored to watch a game for 5 days, and to hear at the end of 5 days the matches are drawn. So the one days came. Again, one day was too long to spend. So they had to compete with football. Right. So in 1.5 hours, who know who has won? Somebody has to win. There's nothing like draw.
Yeah.
Somebody wins. So in 45 minutes, a quick game. So people don't have time now. So that's why they brought 2020 at the right time. Because
Oh,
people want short game and results.
nice.
But it's
Lovely.
a costly game for parents. They have to
Correct.
spend a lot on the coach. Every equipment is costly. Where I see football, should have a shorts, and I see people playing without shoes also.
Uh-huh. So,
Yes.
also, sir, parents kind of keep pushing the kids to go for extra classes, tuitions, this, that children hardly get time for their own fitness or sports. So, how can parents take out that extra time to, get involved with the children in terms of fitness? Because I believe kids also follow observational learning. So, if the parents are also involved in fitness and then they try to get the child involved into it, I think it
No,
would
no.
kind of help more. What do you feel?
I'll give you another tip you find out from the parents. Ask the parents, what does the child do when they come home first from school? 80 out of 100 will say they throw the bag and run into the bathroom.
Bathroom.
They run into the bathroom. Fine. Now, here the question is, our studies have shown, because the parents wake the children just 10-15 minutes before the school timing for the school bus or dropping them, they allow them the child. That's a wrong system. The child needs to be woken up at least an hour before school time. Give your child milk, tea, coffee, juice, whatever you want. So some pressure is built. The child has to go to the bathroom, get herself or himself relieved, and go to school. They will be better students. Now I'll tell you the story. They
Okay.
go to school without going, they're woken up, they go to school. Half of them don't go to the bathroom of school because they're embarrassed or it is not hygienic. They feel scared at their own room. They remove all their clothes, go in and enjoy and come out. In school, they cannot, or a bad experience. They've gone inside and dirtied themselves. They could not manage, so they don't go. Now, such students sitting in the class is not bothered what the teacher is saying. Is only looking at the clock when this teacher will go, right? And when will I go home? So these are the students, when they reach home, they throw the bag and push themselves into the bathroom. And the numbers don't cut because they have not heard, they have not focused to the teacher what the teacher was saying. Our brain is a great machine. If you can listen to what the teacher is saying, you don't need a tuition teacher. You don't need homeworks, right? It is recorded. So whenever the exam that thing is asked, you remember what the teacher has said, you start writing. So why they don't write? Because there's no focus.
Right.
So one of the reason is, and then they say, "Can I just tuition?" Till the time I have sent the child for the tuition, he or she is doing well. Arey, but that tuition was not after school immediately, no, was at home. The child did whatever he wanted
Ah, I
and
see.
then gone to tuition. The focus was there.
Oh,
So I
correct.
request all the parents, again, you have to tell all the parents, please make them sleep early. There is no better timing of sleeping between 11 and 4. That's minimum. So don't say sleep at 12, but instead of 4, I get up at 8 o'clock. That 11 to 4 cannot be. That's the repairing time of your body. So make it a habit, 9 o'clock. Give the food early to your child. By 9 o'clock, they should go to sleep. So whatever time they get up, 6 o'clock, 7 o'clock, wake them 1 hour early from school. Give them tea, coffee, whatever they want, breakfast. There must be a system what they like it. Give them, when they have that, they will go to the bathroom. Send them to school. They'll be a better player, they'll be better focused, they'll be better listener to the teachers, and the results will be fantastic. Again, this was one thing which was missing in our, maybe in our culture.
Absolutely. I think you've just nailed it absolutely right. That's too common in a lot of families. And in fact, in my family also, I've seen my niece doing the same thing that you just said. So I totally agree with you upon that. Also, so nowadays, kids are so addicted to gadgets that instead of spending physically, into physical activities or spending time in playing, they prefer to sit on their tabs or PlayStation, and they want to prefer to play online
I
rather than playing physically.
They can, but let them do it. What I have a condition only. Tell the parents you are allowed. You want to play on the computer, you are given 1 hour. Limit the time first to be on screen. 2, don't allow them to sit on a chair or sofa and play. Give them a physio ball. If they sit on a physio ball, and when they're doing their muscle, the gluteal muscle, the hamstring, the back muscle, the abdominal muscle, they are working. So the core muscle are being used, and they have to balance themselves on the ball when they're sitting. I've tried it at Hinjawadi to the IT workers, and they feel they're better focused on it. Because once you sit on the chair, now the way you are sitting, I'm sitting, we are not bothered about our balance. And we are not bothered also whether any muscle is working or not. But you sit on a ball and see for 5 minutes, see all your core muscle is working. So very soon that physio ball will become a household item. So allow the child, but you're going to sit on the ball for 1 hour and play your games
So,
or be on your internet.
from what age can a child start sitting on an exercise ball?
Earlier people used to say they should not do weight training, they should not do till the age of 18, the height will not go, nothing like that. It has got nothing to do. Any good stretching exercise that they are doing, it will increase the height. They can do pull-ups, hang. Very good. Swimming is the best. Swimmers usually don't for the short swimmer. All swimmers are tall because in swimming it helps you. See, if you have the right composition of the body, you can give your child the right composition, which I said hemoglobin, vitamin D3, vitamin C. A child doing sports at early ages, they get Osgood syndromes, at the tibia level. The growth is from the tibia, just below the knee. Because their growth is faster than the calcium deposition happening there, they get the pain there. So it is a clear sign lack of vitamin D, right? So if you have, I say overall see the body composition. Just don't look the marks. Parents want to know marks. You had come second last time, and this time you were going to come first. You have come fifth, right? So don't give stress to the child. Look, otherwise, I would say the parameter, there should be a subject, there should be a parameter where the child may get 100 out of 100. Whether you could jump so much, whether you could speed, you could complete 100 meters in 14 or 15 seconds. That also should be marks for that. Whether he scored a goal for his school, right? Whether his vital capacity was 4 liters. Why not all that?
Right.
Why not he could run, do this sports, play that game, play 5 games what the school has. There should be marks for that. A fit body has a fit mind.
Absolutely.
Now you see with the baggages that the people go to school, the school kids. Do you know that our studies have shown 12% of the school kids, primary, below 5th, they have scoliosis. 12%. They will grow up with scoliosis, with the spine, shifted to the right or left, depending how they carry the bag. But no child is concerned to mother is concerned to go and do a X-ray and challenge the school teachers. Okay, so what if my child has not done well, got 60 marks instead of 70 marks, but my child is fitter, my child doesn't have scoliosis. My child vital capacity is very good. Because there are no marks for that. So there has to be certain revolutionary changes at school level. Thank God most of the IB schools have a physiotherapist now. So usually I talk to the physiotherapist, this has to be brought into action at school level. Give them marks for it. For their fitness, for their capacity, vital capacity, for the muscle strength, for the posture. Give them mark for the posture. Don't allow a child to sit at an angle and sit and write in class. I see most of the students, they go like that when the teacher is talking or writing on the board, they go like that forward. They have an eye problem. Every year, every 6 months, they should do eye test.
Yeah.
The child prefers sitting, if the selection of seat is given, this other child who always wants to sit in front row because they cannot read from behind.
Right.
You know, so why not an eye check? Every school should have an eye check. Because initially, if the number is at 0.5 or 1, you wear glasses, it will be okay. And
Right.
most of the child today failed because they could not know what the teacher was writing.
Yeah.
So, so the growth, this topic is too big.
Too big.
Are we really concerned how our child, we are concerned which school our child goes. But we are not concerned to see whether my child's hemoglobin will be better in that school, whether my child's future will be better in that school, the posture will be better. There are more games in that school. There are good sports teachers. They will know 5 games when they come out from the school. And after everything, the child has got 90%, gone to medical, comes out with like a sack of potato with 100 kg weight. They want to work on it. Arey, sab kuch barabar hai, lekin he gets tired. He cannot climb 4 stories in school. I have seen people complaining. I have seen schools of 7 stories also. The child
Wow.
is told there is lift in the school, but a child is to go by. Parents go and bring a certificate from the doctor.
So that the child doesn't
I've
have
seen
to
this.
stairs.
My child cannot walk 7 stories.
Oh.
So even if the school decides to get them fit by so that they walk up, the parents will object. So a lot of changes has to come.
Yes, yes. And I think awareness programs, awareness shows, and having more people like you spreading awareness among the parents is something which will help us big
I
time,
wish the
and
parents,
schools also big time to
I
bring.
wish the parents listen. They'll do what they want. They look for shortcuts. They will give 5 rupees, 20 rupees to the child. School mein kuch kha lena,
Yeah.
right? Wake them 10 minutes before your bus is going. The bus is honking. So child gets up, wears something. I've seen school children which they wear the uniform at night only.
Oh.
Put on the shoes. Put on the shoes. And these are the parents' complaint.
Oh
रात
God.
को यूनिफॉर्म पहन के सो जाता है, सुबह जैसा उठा भाग जाता है स्कूल. But will this child go to the bathroom there, the school? Money is also given, or the child doesn't even know something is in the tiffin which is in the bag. After reaching there, he likes, doesn't like, God knows, he has eaten, not eaten. So
Right.
it is a everyday affair. It should, so till where you end, till the delivery, the child mother has delivered, we need another specialty to come in between that till the child grows, what all the parents should be doing. So their job doesn't end. I remember nobody can replace mothers. Nobody can replace what they do. And I would say it's something which cannot be repaid. I see nowadays the mothers are teachers again. Because the homework that comes, the mother has to solve. Either the mother is explaining, writing, or doing it. Then craft work is given to them. The
Yeah.
child is not interested. Again, the mothers are doing it.
Yeah.
So see the super specialty what the mother have. Everything they are doing.
Yeah. Yeah.
And Corona has worsened their job. Some help they had, that help has also gone.
Yeah.
They have to go, buy it, cook it, wash it. Nobody to help for the washing, nobody to help the cooking, nothing. Everything as burden has gone on them.
Yeah.
There, the husband is not getting paid because not going, and the wife is doing 3 times the work. She should have been paid much more now. It's not there.
Absolutely. Women are not paid for the household work that they do.
But
Otherwise, they would make more
but
money.
my salute to all of them.
Yeah.
That 9 month patience, 9 months. That's why I always said all the patients were given to mothers because the God also knew that one day they have to be patients for 9 months. They have to eat well, take care, protect themselves so that a healthy child is delivered.
Right, right, right. Amazing, sir. I think our parents are going to totally love watching this episode. And most importantly, it's about them spreading the word to other parents that it is so important for them to ensure that they let the child grow in a healthy manner. That is more important than the child scoring in the class.
See, there is no difference between male and female anymore. a female is earning as much as a male can earn, right? If you earlier thought only a male was a sportsman, so our female sportsmen have proved they are not less.
Yeah.
They have also become world champion. The earning is same. Then as far as MDs and directors of companies and chairmen of companies are concerned, our women have been same as men, right? So at least thank God that is going away from India. Okay, the child should not be a female, should
Yeah.
be a male. That has gone away because there's no difference between them.
Right.
Both can take care of themselves. Both can take, and I still feel nobody takes care of the parent than a daughter, than
Rightly
a
said.
female. I
Absolutely.
would, being a male also, I will always say nothing to beat the daughters. I've
Absolutely.
got three of them. I've
Yeah.
got three, and the way they take care of me, I know. I'll say, I knew if I had a son, he wouldn't have. On the contrary, he would have rooted me and gone. I want this, I want that, I want that. You have to keep giving them. But the poor girls ask nothing, and they've educated themselves well. Whatever they wanted and demanded, it was been given to them. But the way they take care, I'm very, very sure no male will do that.
Lovely, sir. So thank you so much for sparing out time. It was a wonderful experience, and you have shared so much with us today that I'm sure that parents are going to benefit from it, and moreover, the children are going to benefit from it.
Definitely. And hopefully, I will be coming more on such topics with you. And again, to
Absolutely.
remind
I
you,
think
this
we
was,
should do one episode every month.
uh,
Yeah.
but for the first one.
Yeah.
I had
Lovely.
few of the stars from India and Iran who wanted to be on Insta. And I'm sure if they are watching, they will complain. They had asked me many times. I had not come. But you, I could not refuse. It was
So
lovely.
sweet,
And
you,
I
sir.
feel great hearing, listening, seeing, watching you. I only
Thank
pray
you
keep
so much,
doing great
sir.
work you are doing. And
And
you are
you have
guiding
been
people.
my mentor, sir. It has all happened because of your blessings.
Thanks. God bless. God
Thank
bless you.
you so much, sir. Thank you. Thanks a lot, sir.
Thank you, all the viewers also. Thank you. Maybe I've spoken too much on this topic, but it was a lovely topic and I wanted to talk to Mahima.
Amazing,
Thank
sir.
you.
Sir, thank you. Thank you, sir. Bye-bye.
God bless. Bye bye.
Bye. Thank you,
Sorry,
sir.
have another webinar at 5 o'clock, so I want to get ready for that.
Oh, yes, yes, sir. Okay. Bye. Thank you.
Thank you. Bye bye. God bless.
So that was Dr. Ali Irani sharing such great information about how parents can take care of the well-being of their children, of the fitness of their children, because even I personally feel that it's important that the child develops good immunity during the phase of the childhood, of the adolescent phase, so that the adulthood of the child is secured with good immune system, with good fitness, good well-being, and that is very important. So let's invest in the well-being of your child, of the adolescent phase, for a better future of your child. So on that note, I'm going to wish you all a happy Father's Day and happy International Yoga Day once again. And all you guys take care. And there is the Nitin Mirani. Hi, Nitin. And thank you so much, everybody, for joining in. It was a wonderful conversation with Dr. Ali Rani. And have a nice day, guys. Take care. Bye bye.